The immune system is the body's defense network that protects against infections, foreign substances, and harmful microorganisms. It's made up of cells, tissues, and organs that work together to recognize, attack, and remember pathogens. Understanding how the immune system works helps you support patient care, infection prevention, vaccine education, and early recognition of immune-related problems. Immunity is the body's ability to defend itself against infectious agents, foreign substances, and harmful microorganisms. This is the foundation of how the body prevents, fights, and remembers infections. And it's a key concept in nursing, epidemiology, and patient education. The immune system uses cells, tissues, and organs to recognize and destroy threats while protecting healthy tissues. Immunity is divided into two major types, innate and adaptive. It can also be classified as active or passive, depending on how the immunity is acquired. There are several things that impact how strong a person's immune system is, such as age, nutrition, chronic diseases, medications, stress and fatigue, vaccination status, and skin integrity and integrity of mucous membranes. Innate immunity is the body's first line of defense, offering immediate protection. This type of immunity is present at birth, is fast and immediate in response, defends all pathogens in the same way, and does not improve with repeated exposures. The components: physical barriers such as your skin, mucous membranes, and cilia in the respiratory tract, chemical barriers such as stomach acid and enzymes in tears and saliva, cellular defenses such as neutrophils, macrophages, and natural killer cells, inflammatory response, redness, heat, swelling, and pain, and this is helpful in isolating and removing pathogens. Fevers, which slow down pathogens and boost immune cell activity. In recognizing normal versus abnormal inflammatory responses, nurses are able to recognize early signs of infection. It is important to teach hygiene and skin protection and monitor fever and infection symptoms. Adaptive immunity provides targeted long-term defense. It develops after exposure, it is specific to each pathogen, it forms memory cells, and it is the basis for vaccine protection. There are two branches: humoral immunity, which is B cell mediated. B cells produce antibodies and neutralize pathogens in the body fluids. The antibodies function to recognize antigens, mark pathogens for destruction, and prevent attachment to host cells. There's also cell-mediated immunity, or T-cell mediated. T cells destroy infected or abnormal cells. This is critical for viruses, fungi, and cancer surveillance. Acquired immunity, also called adaptive immunity, is the type of immunity a person develops after exposure to a pathogen or via vaccination. It is highly specific, meaning it targets particular microorganisms and provides long-term or lifetime protection due to memory cell formation. This system helps the body recognize, attack, and remember pathogens so future infections are mild or prevented entirely. The characteristics of acquired immunity are specificity, targeting a specific antigen; memory, after the first exposure, the memory remains for months to years; delayed initial response, it takes several days to fully activate during the first exposure, and it improves over time. There are two major types of acquired immunity: active and passive. Active immunity produces its own antibodies. The natural active immunity occurs after surviving an infection. Artificial active immunity occurs after vaccination. Passive immunity is when the body receives antibodies made elsewhere. No memory cells are created, such as natural passive immunity when transferred to parent or infant. Artificial passive immunity, given through medical treatments, such as monoclonal antibody therapy or antivenoms. Active immunity is the body's ability to make its own antibodies. Natural active immunity occurs after infection and long lasting, sometimes even your lifetime. Artificial active immunity occurs after vaccination. The immune system is trained without illness. Passive immunity is when the antibodies come from another source, not the person's own immune system. Natural passive immunity is passed from pregnant women to their fetus, and the antibodies are present in breast milk. Artificial passive immunity is such as immunoglobulin injections after exposure to hepatitis A or rabies. Passive immunity works immediately and provides short-term protection, weeks to months. Humoral immunity is one of the two major branches of the adaptive immune system. It involves B cells and the production of antibodies that circulate in the blood and body fluids to attack pathogens. This type of immunity is especially important for fighting extracellular pathogens such as bacteria, viruses before entering cells, and toxins. The purpose is to protect the body by recognizing foreign antigens, producing antibodies to neutralize or destroy invaders, creating memory cells for long-term protection, and preventing reinfection. It is the main immune response activated by vaccines. There are several types of antibodies. IgM, first antibody produced during infection and good for early detection and initial defense. IgG is the most common antibody and provides long-term immunity and can cross placenta to protect newborns. IgA is found in the mucous membranes, also present in saliva, tears, and breast milk, and it protects entry points of the body. IgE is involved in allergic reactions and parasitic infections, and IgD helps to activate B cells. The functions of the antibodies are to help eliminate pathogens by neutralization or blocking toxins and viruses, opsonalization by marking microbes for destruction by phagocytes, agglutination is clumping pathogens for easier removal, complement activation is helping destroy bacteria, and by preventing attachment. The body responds differently the first time it encounters a pathogen compared with later encounters. These two processes are called primary and secondary immune responses. Understanding the difference helps explain why vaccines work, why repeated exposure leads to faster protection, and why the first-line illness is often the most severe. Primary immune response occurs when the body encounters an antigen for the very first time. Key features are slow onset. It takes 5 to 10 days before significant antibodies appear. Innate immunity responds first with inflammation or fever. Adaptive immunity activates next. IgM antibodies are produced first. IgG antibodies appear later. Symptoms tend to be more noticeable because the body is still learning the antigen. A secondary immune response occurs with any future exposure to the same antigen. Key features are a much faster response within hours to 1 to 3 days, stronger and longer lasting antibody protection. IgG antibodies dominate immediately, often no signs or symptoms appear, and caused by memory cells formed during the primary response. This matters for nursing practice because vaccination creates a primary response without causing an initial disease. Booster shots reinforce the secondary response, giving a stronger immunity. The cellular immune response, called mediated immunity, is the branch of the adaptive immune system that relies on T lymphocytes rather than antibodies. This response is essential for fighting intracellular pathogens, or organisms that hide inside the body's cells. These include viruses, some bacteria like tuberculosis, fungi, parasites, and abnormal cells such as cancer cells, as well as transplanted tissue or organs, such as in the rejection response. There are key players in the cellular immune response. T cells produce in the bone marrow and mature in the thymus. There are three major types: helper T cells, which coordinate the immune response; cytotoxic T cells, which attack and destroy infected or abnormal cells; and the memory T cells that live long. The cellular response is needed when the pathogens are inside the host cells where the antibodies can't reach them. There are steps in the cellular immune response that include recognition, activation, attack, and memory function. The immune system is designed to protect the body from harm. However, sometimes it responds incorrectly, excessively, or inadequately, resulting in abnormal immune reactions. These abnormal responses can lead to allergies, immune disorders, chronic inflammation, or increased susceptibility to infection. Abnormal immune reactions are grouped into three major categories. Antibody-mediated reactions occur when the immune system produces antibodies that trigger harmful effects in the body. These reactions are part of the broader category of hypersensitive reactions, specifically type 1, 2, and 3 hypersensitivity responses. These reactions range from mild allergic reactions to severe life-threatening situations like anaphylaxis or hemolytic reactions. These reactions are abnormal because the immune system response becomes overactivated or misdirected. Acute anaphylaxis or anaphylactic shock is the most severe form of allergic reaction. It is life-threatening, has a rapid onset type 1 hypersensitivity reaction, which is caused by a massive release of histamine and other inflammatory mediators from the mast cells or basophils. Without immediate treatment, anaphylaxis can lead to airway obstruction, cause severe hypotension, cardiac collapse, and even death. Anaphylaxis occurs after an exposure to an allergen in a sensitized person. It progresses rapidly, sometimes within seconds to minutes. Vaccines train the immune system to recognize and fight pathogens before they can cause severe illness. Different vaccine types work in different ways, but are all designed to stimulate active immunity by exposing the body to antigens safely. There are 5 major types of vaccines. Live attenuated vaccines contain weakened or attenuated versions of a living virus or bacteria. They cause strong, long-lasting immune responses because they mimic natural infection. Examples are MMR, varicella, rotavirus, and the live attenuated influenza nasal spray. There are usually 1 or 2 doses that provide the long-term immunity, and they cause strong cellular and humoral responses. They are not safe for immunocompromised patients or pregnant individuals and must be stored carefully because they are temperature sensitive. Inactivated or killed vaccines contain pathogens that have been killed so they can't replicate. Examples are the inactivated polio vaccine, or IPV, hepatitis A, and even some influenza vaccines. They are safe for immunocompromised patients, and there's no risk of causing disease. The disadvantages is they are weaker immune responses and usually require multiple doses or boosters. Toxoid vaccines are made from bacteria that cause illness through toxins. The toxins are inactivated to form toxoids, which then stimulate immunity. These are vaccines such as tetanus, diphtheria, and part of the Tdap or DTaP vaccines. They are safe and stable and provide excellent protection against toxin-producing illnesses. However, they do require a booster every 10 years. Subunit, recombinant, or conjugated vaccines. These vaccines use specific pieces of a pathogen, such as a protein, sugar, or surface antigen, rather than the whole organism. These are vaccines such as hepatitis B, pneumococcal, meningococcal, and HPV vaccines. They are very safe, strong targeted immune response, and suitable for immunocompromised individuals. However, they often require multiple doses or boosters. mRNA, or viral vector vaccines, is a newer technology used widely during COVID-19. These contain mRNA that teaches cells to produce a viral protein which triggers an immune response. Advantages: they provide a strong immune response, it's not a live virus, and they are fast to develop. However, they require cold chain storage and booster doses may be needed. The viral vector vaccines use a harmless virus to deliver genetic instructions for an antigen, such as the Ebola vaccine. It provides strong cellular immunity. It is safe and effective, but not ideal for people with certain immune disorders. So what is the nurse's role? To provide education and explain how vaccines work, to teach the difference between vaccine types, to screen for allergies or contradictions prior to vaccine administration, to monitor for side effects, to maintain accurate records, and to reinforce importance of boosters. White blood cells, or leukocytes, are the body's primary defender against infection, inflammation, and foreign substances. Each type of white blood cell has a specific role in identifying, attacking, and removing pathogens. Understanding how white blood cells work helps you recognize infection, inflammation, immune disorders, and responses to treatments. There are 5 main types of white blood cells involved in immunity: neutrophils, lymphocytes, your B cells, T cells, and natural killer cells, monocytes and macrophages, eosinophils, and basophils or mast cells. Each contribute differently to an immune defense. The neutrophils are the first responders. They arrive first at the site of infection and perform phagocytosis. They are the most active in the acute bacterial infections. Clinical clues: you will see a left shift, which is an increased immature neutrophils band in severe infections, and an increase in neutrophils with bacterial infections, burns, or inflammation. Lymphocytes, the targeted adapt defense, has 3 types: B cells, which produce your antibodies in your humoral immunity; T cells, which are the helper cells which coordinate the immune response; the natural killer cells, which attack the virus, infection, or cancer without exposure, and they are part of innate immunity. These are important in viral infections and immune disorders. Low lymphocytes can be seen in immunodeficiency, chemotherapy, and HIV patients. Monocytes and macrophages are your big eaters and cleanup crew. They circulate as monocytes and mature into macrophages and tissues. They perform powerful phagocytosis, and they clean up dead cells, debris, and pathogens. They are important in chronic infections such as TB and fungal infections, and they increase in inflammatory disorders. Nursing importance of recognizing prolonged inflammation and for monitoring chronic infection symptoms. Eosinophils defend against parasites and mediate allergic reactions. They counteract histamine. They are elevated in asthma, allergies, eczema, and parasitic infections. It is important to monitor for an allergic reaction. Basophils and mast cells release histamine, heparin, and other inflammatory mediators. They trigger inflammation and are involved in type 1 hypersensitivity reactions. They are a major source of histamine during an allergic reaction. The basophils increase with inflammation and some allergic conditions. Nursing relevance is administering antihistamines and epinephrine per order. So how do your white blood cells work together? The first line is the neutrophils that rush to the site and destroy bacteria. Next, your monocytes or macrophages come in, and they phagocytize the remaining pathogens and debris. Next, the lymphocytes become activated. They then coordinate. This coordinated defense eliminates pathogens and prevents reinfection. It is important for you to know the normal white blood cell count, what a leukocytosis indicates, such as an infection. Bacterial will be neutrophils, viral will be lymphocytes. Inflammation, stress, and tissue injury can also cause high white blood cell count. Leukopenia is caused by bone marrow suppression, chemotherapy, autoimmune disorders, and severe viral infections. Your role will be to monitor the CBC results, report critical changes, and implement infection control precautions for immunocompromised patients. Vaccines are one of the most effective public health interventions. They protect individuals and communities by training the immune system to recognize and respond rapidly to specific pathogens. The key in how vaccines work lies within the immune memory, or the ability of the adaptive immune system to remember past infections and respond faster and stronger when exposed again. Vaccines safely introduce a form of antigen into the body. This then trains or prepares the body to fight the real pathogen later. Immune memory is the foundation of long-term key protection. This is why most people only get a disease like chickenpox once, and why vaccines help prevent severe illness. If the person later encounters the actual pathogen, the vaccinated individual will rarely develop severe disease. Some vaccines require booster shots to remind the immune system. When enough people in a community are vaccinated, it then provides herd immunity. This collective protection contributes to public health safety. There are three major types of immune system disorders. Immunodeficiency is the weakness or missing immune system itself. Examples include HIV or chemotherapy suppression. Hypersensitivity, which is the overreaction to harmless substances, such as an allergic reaction or even anaphylaxis. And lastly, autoimmune conditions, in which the immune system attacks the body's own tissues, in conditions such as lupus and rheumatoid arthritis. The relevancy for LPNs is recognizing allergic reactions, monitoring for infection in immunocompromised patients, and supporting chronic disease management. When a pathogen such as a virus, bacteria, fungus, or parasite enters the body, the immune system launches a coordinated defense response. This process occurs in predictable stages that involve both innate and adaptive immunity. Understanding this response helps you explain symptoms, recognize infection early, and support interventions that strengthen the patient's immunity. The first line of defense is barrier prevention. Before the body mounts an internal immune response, it tries to stop the invader from even entering. This is done with intact skin, mucous membranes, and cilia in the respiratory tract. Chemical barriers such as tears, saliva, and mucus, stomach acid, and normal flora may also provide barrier. The second line of defense is the innate immune response. This is the immediate, nonspecific response that occurs once an invader breaches the surface. Inflammation is the hallmark of early immune system response. Signs are redness, heat, swelling, and pain. The purpose of inflammation is to increase blood flow, recruit immune cells, and they contain and destroy pathogens. Phagocytosis occurs when white blood cells, such as neutrophils and macrophages, engulf and destroy the pathogens. The body having a fever is used to slow pathogen growth and to signal the body to increase immune activity. The third line of defense is the adaptive immune response. If the innate system cannot eliminate the pathogen, the adaptive immune system activates. It is specific and has memory, leading to a stronger protection in future exposures. This can include antigen recognition, in which immune cells identify unique molecules on pathogens, activation of lymphocytes. The two major lymphocyte types respond: the B cells, or humoral immunity, which produces antibodies and neutralizes bacteria and viruses, and the T cells, which destroy infected cells, and it's important for viral infections and cancer control. The formation of memory cells, of memory B and T cells, remain long-term. They provide faster, stronger responses on future exposures, and they are the basis of vaccine effectiveness. After immune activation, one of several outcomes occurs. The pathogen is removed and healing begins. Chronic infection sets in due to a weakened immune system or pathogen evasion. Tissue damage from prolonged inflammation or immune overreaction may cause harm, or serious illness. If the immune system response is overwhelmed, infection becomes systemic. The clinical manifestations of immune response are important for you to recognize. They are fever, fatigue, swelling or redness, pain, purulent drainage, elevated white blood cell count, and enlarged lymph nodes. Your role is to provide assessment, intervention, and patient outcomes, or patient education for improved outcomes.